So now we're moving on to the psychological impacts of thyroid cancer. It's a great pleasure to introduce Kate Kendell, who's our next speaker. Kate, thank you.
I'm just pressing this. Am I just pressing this?
Use those.
Please, right.
Yeah, I'd leave that.
Just this,
Yeah.
thank you. Just getting instructions on the technology. I'm very, very delighted to come and talk about the psychological impact of thyroid cancer. Thank you very much, Kate, for inviting me. I'm starting from a premise that every patient is an expert on themselves, and as healthcare professionals, we bring our own background and expertise to work alongside the patient. This is a diagram that I share with nearly all my patients. I find really helpful from my colleague James Brennan in Bristol. And it shows the fact that we are all on a life journey. We all have a life story, a life path that we're on, with our past history behind us and our sense of who we are and where we're going in our lives and what the future might hold. And when a traumatic, unexpected event happens, like a diagnosis of thyroid cancer, it blows somebody's whole world apart and pulls the rug completely from under your feet, and everything is up in the air. And usually there's a stage of shock and disbelief, but things are quite well monitored. In the treatment phase, people are directed to what they need to do, to go for tests and more tests, to go for surgery and maybe more surgery, and then maybe radioiodine treatment. And then at some point, patients come out the other side of that and are told to go on and get on with their lives. But that can be much easier said than done, because it can feel like the path has been blown away and there is no normal life to be getting on with. One patient of mine recently said to me that he felt as if he had just been released from prison, that he'd been stuck outside the prison gates and told to go off and get on with his life, but he didn't know what direction to go in. So the job is to build a new kind of normal. It's not going to be exactly the same as it was before, because some very practical things might have changed, but also your sense of who you are and what the world is like and what the future might hold may well have been disrupted. And there might be some quite unwelcome and difficult things on the new journey. But I can also say that there can also be some very positive things on the new journey. And for some people, it's an opportunity to take stock of their lives and reconsider what's really important to them and to make some positive changes, so that in time, people can find benefits from a very adverse experience. Often thyroid cancer is talked about as a good cancer. And I'm sure this is always said in a well-meaning way to be helpful to patients, and it is because for many, many people it carries a very favourable prognosis in comparison to some other cancers. But it's a two-edged sword. Although some people find that reassuring, it also minimises, there's a risk of minimising the impact of thyroid cancer and mean that patients aren't adequately prepared for what lies before them. It means that people's needs can be overlooked, that it's harder to access help, and for some people they have a sense of guilt or inadequacy if they are told that they've got a good cancer but then find themselves struggling to cope. When somebody is first told that they have cancer, it doesn't matter what kind of cancer it is, usually the first thing that goes through somebody's mind and the first question they ask is, am I going to die? The threat to survival is paramount. And in thyroid cancer, usually people are given a favourable prognosis, but that may take quite a bit of time to accept that there's a favourable prognosis and that there may not be an imminent risk to life. Over time, what becomes more apparent is the threat to self. That is the threat to you as a living person. And in thyroid cancer, that can be great. So the threats to self are very idiosyncratic and personal to each individual. Everybody has different things that are important to them and different parts of the impact that are more or less difficult. But classic things in thyroid cancer are body image, and that might be about the scar for people who have for whom the scar is very visible, that it's a constant daily reminder every time you look in the mirror of what you've gone through and the diagnosis, and it's something that other people may comment on. Also, weight gain is very, very commonly reported as a difficulty, and that can be associated with loss of self-esteem and loss of confidence. energy levels. I think we've already alluded to this, that even though your blood results might look great, you might feel absolutely dreadful. And the isolation during radioactive iodine can be very difficult for some people. I have some of my patients say to me that they really welcome 2 or 3 days on their own in a room with nobody else to bother them. But for more people, it is something that is a difficult experience to be physically and socially isolated at a time when you actually need more comfort and more support. Thyroid dysregulation, as we know, can take a long time to get stable, and this is very difficult for people. Calcium changes, anybody who's been hypocalcemic, that can be a very, very scary experience, and also one that people haven't been adequately prepared for sometimes, and then can lead to fear of that happening again. Voice changes, again, we've alluded to this, can be very difficult, and more difficult for people who particularly rely on their voice. We all do, I think, but some people more in particular. I have a patient recently who worked in PR and was responsible for chairing a lot of teleconferences and found the loss in voice power very, very difficult. And another patient for whom her main social outlet was singing in a choir, where she got a lot of her social support, and she wasn't able to do this for a long period of time. Reliance on medication can be very difficult for people, and again, a constant reminder of the diagnosis. There's a threat to your personal world. That can be work roles, and because thyroid cancer typically affects a relatively young population, people with thyroid cancer are 2 times more likely than people with other types of cancer to be in paid employment. And so this could be great issues about going back to work, possibly loss of employment status, and adverse effects on financial status, either temporary or permanent. There can be a great strain on interpersonal relationships, including intimate and sexual relationships, strain on family roles, social roles, and leisure roles. And a lot of that is about the fact that thyroid cancer is often not heard of, is often poorly understood, and that following treatment for thyroid cancer, you may look very much the same as you did before. And your employer, your partner, your friends may think that once you've gone through treatment, you're going to bounce back to normal and take up all your same roles and responsibilities. And that, again, is something that is much easier said than done. There is a threat to the future. The lifelong follow-up and surveillance is a two-edged sword. For some people, it's a source of comfort, but it is also a constant reminder of your disease. It's very difficult to ever put it completely behind you, and can lead to a disabling fear of recurrence. Uncertainty is something that we as human beings don't cope well with anyway. Before a very difficult event happens in our lives, typically we overestimate our sense of control over our world, and we underestimate the probability that something very difficult might happen to us. But after a very difficult life event, the pendulum swings the other way, and we can greatly overestimate the possibility that something else very difficult is going to happen to us, and underestimate the degree of control that we have. And financial security can be a long-term impact as well. So the sense that people make of the threat to their survival and the threat to themselves as an individual gives what we call the personal meaning of cancer. And that is really the answer to what does this cancer mean about me, my world, and my future? And when working with people in terms of psychological support, it's very important to understand what this means to each individual in order to be able to help them effectively. This is a bit of a complicated model, but the main message is that adjustment to any type of illness, including cancer, is a process that takes time. And a key question alongside what threat is this is what capacity do I have to cope with this threat? Just to pick out a couple of examples, somebody who perceives the diagnosis as a challenge may be more likely to consider themselves to have a capacity to cope and have resources to cope, and may show what is termed fighting spirit, and be much more likely to engage in active coping strategies which are going to be helpful. By contrast, somebody who perceives the cancer as a harm that has already happened and is an irrevocable loss is much more likely to develop a helpless and hopeless coping stance, to be very passive in their coping, and to be at risk for depression. So what we know from the research is that despite a favourable prognosis, around 1 in 3 people with thyroid cancer experience a very high level of distress. The impact on quality of life is significant and at least equal to other types of cancer, which may carry a more favourable prognosis. And the impact is not just about the individual who has the cancer, but also about loved ones. And all the research evidence and clinical experience shows that loved ones can be equally affected, although in somewhat different ways. Commonly reported problems by people with thyroid cancer are fatigue and tiredness to a very disabling degree, anxiety and or depression, which are the common causes of psychological disorders anyway, but are much more common in a population of people with cancer, loss of fitness and energy, sleep problems and weight changes. And all these problems can have biological, psychological and social factors that are contributing to them. It's helpful to think about distress along a continuum. It is completely normal and expected that after a diagnosis of thyroid cancer, that there is going to be some sadness, a sense of vulnerability and fear. And we would expect to see that for a period of at least 6 weeks. In the longer term, if the distress continues at a high level, the medium to longer term, and it is interfering in somebody's ability to get on with their life and engage in normally enjoyed activities and roles, then we would call that a clinical level of distress. And then about 10% of people at the other end of the spectrum actually merit a diagnosis, a formal psychological or psychiatric diagnosis, and should be referred to a mental health specialist. The typical presentations of distress that we see from referrals to psychology are anxiety and or depression are the most common, difficulty coping with treatment, struggling to re-engage with life. That's a really common point of referral at the end of the initial treatment when people are meant to be going out and getting back on with their lives and find that a real challenge. Fear of recurrence to a disabling level, relationship and interpersonal difficulties, body image distress, anger, loss of confidence and employment difficulties. What we know helps is, and this can be from healthcare professionals and others, good communication that is tailored right from the start. And we know that if the information is got right, if people are satisfied with the level of information that they have at the beginning, at the point of diagnosis, that is protective against developing depression and anxiety later on. So it's extremely important. Holistic assessment. Everybody should be offered a holistic assessment at different points on their cancer journey. And that is an assessment that gets to know you as an individual person and finds out what are the concerns and worries that you have that may be related or not to your thyroid cancer. So very important for healthcare professionals to be able to elicit those concerns and problems. And screening for psychological distress is very important. Still, the majority of psychological distress goes undetected by healthcare professionals. Shared decision-making with your multidisciplinary team, and all the above to be ongoing throughout your experience. Collaborative problem solving with your healthcare team and others is very important. And where applicable, a supported and phased return to work to ensure that you're more likely to make a successful return. Onward referral and signposting to problems that the immediate MDT do not have the particular skills to work with, other things that are tangentially related. Easy access to psychological support, peer support, support from family and friends is extremely important. And some people find writing about their experiences helpful. That can really help with the processing of information, particularly for people who might find it more difficult to talk about them. This is what all adults with cancer should be getting in terms of psychological support. This is from the National Institute of Clinical Excellence, and it is being revamped as we speak and is due to be republished in January 2018. So all health and social care professionals that you come into contact with should recognise the importance of psychological needs and be able to give effective information, to communicate with you in a compassionate way, and to offer general psychological support. At level 2, one member of every cancer multidisciplinary team should be trained to screen for psychological distress and use simple psychological techniques to work with distress. And those individuals are typically the clinical nurse specialists, but they can be anybody in the team. And they are very, very important in detecting who should be referred on for higher levels of psychological support. I think level 2 is probably the most important level of psychological support. So level 3 would be being referred on to somebody who has accredited training in a specific psychological technique. So it might be counselling, it might be anxiety management. And that accounts for about 15% of people should be referred on for that level of support. 15% of people warrant that. And then a further 10% of people warrant referral to a mental health specialist, so a clinical psychologist, or in some areas a liaison psychiatrist. And those individuals would be capable of diagnosing psychological or psychiatric disorders and using a range of psychotherapeutic interventions that are active interventions to enable you to change things and cope better with distressing situations. So examples of interventions would be cognitive behaviour therapy, interpersonal psychotherapy, acceptance and commitment therapy for people who have post-traumatic stress disorder, eye movement desensitisation reprocessing, or a systemic family or couple intervention. So I have to say that some people worry about being referred to level 4 and being referred to clinical psychology or liaison psychiatry, and some people will say, does this mean that I'm going mad? And I have to say that I very, very rarely see anybody who is mad. I see very, very normal people who are dealing with very difficult, adverse life circumstances. So what we can say about the psychological impact of thyroid cancer is that thyroid cancer is a negative, generally unexpected life event that has many difficulties associated with it, and the psychological impact is significant. However, it's not all negative, and it is commonly seen that people experience what is called post-traumatic growth, which is basically benefit finding, some silver lining that comes out of a very adverse experience. And for some people, it takes quite a long time to find this, but I see it a lot, that people that I've worked with can actually say that something good has come out of it. They would never have chosen to be diagnosed with thyroid cancer. It was a very, very difficult event, but some good things can come out of it. And an example was a man that I worked with a number of years ago now who said his diagnosis was like being knocked off the treadmill of life. And it was very difficult being knocked off, but it forced him to reevaluate where he was in his life and to think about what was really important to him and where he wanted to be going, and to make some positive changes. So things that have been found particularly in the area of thyroid cancer are a sense of hopefulness, a renewed sense of purpose in life, and improved family relationships, and a greater appreciation of family and friends. A review of priorities, for example, work and relationships, and motivation to address long-standing problems. So that might be getting out of a relationship that has been a problem for a long, long time, or addressing an underlying psychological difficulty that has gone untreated or undealt with for a long time, or dealing with a work-related problem that hasn't been addressed before. Overall, many people show a real determination to live life to the full. So, can end on a positive note. Thank you.